As Uganda celebrates the World TB Day at Butareja District, the non-government organization spearheaded by USAID joined the Ministry of Health to celebrate that day under the theme "We Can End TB in Uganda," where more than 500 people tested for TB in Butareja and 70 found positive without knowing. Dr. Mary Nabukenya, the project manager from USAID under the Ministry of Health, confirmed the outbreak, but attribute this due to the lack of awareness for TB in the community.
Dr. Mary Nabukenya, I'm the project director for the USAID Local Partner Health Services TB activity, which is a partner project to the Ministry of Health. Today we are here in Butareja Boma grounds to really raise awareness about TB. Butareja is one of those districts that the ministry had identified that the population knows very little about TB. And this Bukedi region, already they have tested and found 70 TB cases. They are continuing to test. So I know they are going to give us this report, but we know that the partners are helping us to see that we quickly test these samples and we give results to our patients, but also those that we find with TB, we treat them free of charge. We have noted that the population knows very little about TB, and yet the symptoms, if you are coughing for 2 weeks, please come to the health centers. The health workers are there to receive you and test you. And also the health workers, please, when you receive these people that have actually come to you complaining of cough, don't just brush them off and give them antibiotics.
The district health officer explains the concern and appealed the government to come to their aid before the situation escalates.
I'm grateful to Ministry of Health for bringing this commemoration of World TB Day, the national celebration, to Butareja, because it has opened our eyes. We have so far received 70 clients being positive for TB. This is really a lot. This shows it is just a tip of the iceberg. We have a big problem, but we have not been showing it up. And it calls for serious reorganization of health services, especially getting information to the people. We have also discovered a gap in the lack of awareness in the populace. People don't know about TB, and a little time we've had massive mobilization about TB. People have come up and we've got this big number.
Respondents explained their need in health, including lack of awareness about TB disease, and urged the Ministry of Health to rescue them.
I've seen around about 5. When you check 10, you get at least 2 who are positive. It is serious. So we need a quick response to this disease.
Paul Nibenda, a TB patient in Butareja district, said Poor service for TB disease. Lack of medicine in facilities still a challenge.
Basaba bamu olampeda gati bava ku magezi gonna oba okolotya kati awabeera stack otandise kulimira otya onokulya otya such things olidde bwoba tofunye advice kuba abasawo bano osobola obutategeera ngeri ki yokukola ki okumiramu eddagala eryo waliwo ogendera nga oluusi ne ali responsible to give out medicine taliwo ebintu ebimu ngeri otuuka awo n'otuula ate dokita musawo gundi taliwo ate agukolako aliwo not everybody amala kuyingiza mu kitabo awandiike biki oleete ne fayiro awandiikeko nti kati from now.
Despite that, the government still facing challenges for fighting against tuberculosis, USAID have increased their effort to engage government through the Ministry of Health to ensure that TB is eradicated.